Since the stay-at-home order started, we've heard much about another pandemic that swept through the country. It was the Spanish flu. But what was it, and how did it affect our community? 17's Taylor Schaub takes us back more than 100 years.
The image is all too familiar. Frontline medical workers risk their lives to treat the sick. A nation retreats to its homes. America's streets abandoned as our economy shuts down, including Kern County. Looking at today's Bakersfield skyline, it almost seems impossible to imagine that 102 years ago, Kern County faced the single largest disaster in its history. It was October 1918. The Spanish flu tears across the global landscape like an out-of-control wildfire. Millions are believed to have died.
When the Spanish influenza came through Kern County, it was catastrophic.
Garth Milam, a retired firefighter and local historian, has spent nearly 2 decades studying what he calls the forgotten flu. Right
now, our research has indicated that probably as many as 800 or 900 residents of Kern County had died. What made it even worse, though, was who it killed. It killed young, active people.
Unlike COVID-19, which targets mostly the elderly.
This person was 20 years old, died November 20th, right in the middle of the epidemic.
Milam reading grave markers at the Midway Cemetery in Taft, the final resting place of nearly 100 victims of this deadly disease. By 1918, Kern County had become an oil-rich boom town. Thousands of young families moved into crowded camps in places like Taft and Maricopa. Ken Hooper is an archivist at Bakersfield High School.
And the Spanish flu was so bad, there are cases in Taft where an oil worker went to work in the morning, and at lunchtime they told him his wife was sick and she was dead by the afternoon.
What few hospitals and mortuaries that existed were completely overwhelmed.
Everyone had lost someone they knew, and the one they lost was someone young. Millions of orphans were created. Millions of orphans just in the United States. Kern County, like a lot of communities, shut down their schools, shut down their bars, their restaurants, their churches, and their theaters.
By October of 1918, the flu had arrived in Bakersfield. And there was a call in early October for people to make homemade masks. And there was an ordinance passed by the city of Bakersfield to wear them in public.
But not unlike what's happening in America right now.
There was quite a clamor to open up again, much like there is today.
And everything did, and that's when the second wave came. Bethany Rice is the curator at the Kern County Museum.
So that second wave was even worse than the first wave. It hit harder and it hit more people because people were being infected and already out walking around. And once you lift a quarantine, and this is what they struggled with in 1918, they could not bring the quarantine back.
Government agencies often are very reluctant to reinstitute social distancing and banning gatherings, because the public simply can't tolerate it.
Which brings us back to today. Dr. Hemel Cothry is the Chief Medical Officer for Dignity Health Central California.
Everything we've looked at tells us that this virus is not going away. You know, these viruses tend to mutate a lot, so there's a chance it can come back worse. But one of the things that we have now in our favor that they didn't have in 1918 is technology.
Looking at Kern County, Cothry believes
I think our curve is flattened, and if you look at our death rate, you see its majority is limited to these nursing homes. So I think we're definitely ready to open now.
But Garth Milam cautions.
There's one clear consistency that existed in 1918 and probably exists today, and that's an inordinate amount of self-centeredness. People look at the influenza through their own lens. They see it as how it affects them.
So will we learn from our ancestors or fall to the same fate as they did over 100 years ago? In downtown Bakersfield, Taylor Schaub, 17 News.